HIV can be diagnosed through rapid diagnostic tests that provide results on the same day. This greatly facilitates early diagnosis and treatment and preventing the disease. However, no single test can provide a full HIV positive diagnosis. Confirming testing is required and it should be conducted by a qualified trained healthcare worker or a community worker. HIV infection can be detected with great accuracy using nationally approved testing strategies and algorithms. HIV diagnostic tests, they detect the antibodies which are produced by the person's immune system to fight the HIV infection. In most cases, people develop antibody to the HIV within 28 days of infection. During this time, people are in the so-called window period when they have a low level of antibody which cannot be detected by many of the rapid tests, but they may still transmit the HIV to others. People who had a recent high-risk exposure and test negative can have a further test after 28 days. HIV tests are typically performed on blood or oral fluid. They may also be performed on urine. Antibody tests can usually detect the HIV from day 23 to 90 days after the exposure. In an antigen and antibody testing, we look for both HIV antibody and for the antigen. Antigen antibody tests, they look for both HIV antigen and for antibodies. And these antigen and antibody tests, they usually detect the HIV from day 18 to 45 days after exposure. HIV nucleic acid testing, which is otherwise known as the NAT, it looks for the actual virus which is present in the blood. This test can tell you if a person has HIV or how much virus is present in the blood. NAT can detect the HIV sooner than other type of tests. This test should be considered for the people who have had a recent exposure or a possible exposure and have early symptoms of HIV and who have tested negative with an antibody or antigen antibody test. Let us see some of the common HIV antigen and antibody testing. ELISA antigen and antibody testing has been done. Immunochromatographic testing is also done for antibody testing, and Western blot is also done for antibody testing. And HIV nucleic acid testing, it is done to check the viral load.